Now, this can definitely be tough on a family, but miscarriages can be the toughest thing that a woman or a family go through. And if it happens over and over, you may need help from a doctor. Well, today we're going to be helping you out. We have OBGYN Dr. Corey Tinker joining us from the Alabama Women's Specialist. Dr. Tinker, how you doing?
I'm doing well, Sheldon. Good to talk to you.
Good to talk to you. We had a few discussions beforehand. I had mentioned that my family had gone through this one time before, but multiple miscarriages. Kind of explain that to people. How common is that?
Well, people don't understand that miscarriages can be very common and are very common. And so I encourage those couples and those women out there that may have gone through a miscarriage not to necessarily think that something is wrong. 20 to 25% of all pregnancies will end in miscarriage. That's not that anybody did anything wrong. It's just we as human beings have those problems. Now, when you start to have 2 or 3 miscarriages, no, there may be some underlying issues beyond just what can happen. There may be underlying issues that a doctor needs to look at and a patient needs to talk about so that they can get answers and begin to understand. It's a very scary, very lonely place to have a miscarriage. Nobody talks about it. You don't mention it. You don't bring it up. And so it can be a very isolating space. We don't want that to be there. Doctors are here. We can talk. Let's do it.
I understand. I guess one of the things that we could also ask about recurring miscarriages, could it involve infertility?
Yeah, and that's probably one of the biggest problems that we deal with is society views the world that if you don't wind up with a baby, it's infertility. That's not true. Not being able to get pregnant or having difficulties getting pregnant versus getting pregnant but miscarrying are 2 entirely different situations. Women that tend to miscarry tend to have vastly different issues and psychologically have vastly different issues than a couple that can't get pregnant. So having multiple miscarriages is not infertility. There's something else going on. Talk to a doctor. Talk to your doctor. Find someone who will listen and walk it through with you.
Yeah, so it would make sense that if you do have 2 consecutive miscarriages, that you do want to talk to a specialist.
Right. It does not necessarily mean that there's problems. Remember, 25% of the time it's going to happen. And so there are some people that it's just bad luck. But if you have 2, it's at least worth now speaking to your doctor. It doesn't matter if they're consecutive. You can have a miscarriage, have a baby, and have another one. Still worth at least exploring, making sure something's not hiding out there that all of us need to deal with.
Very well, Dr. Corey Tinker. And I should mention that after we suffered one through our family, we did have, that was after our first born child. Sure. We did have 3 additional children. So it was something that we were able to overcome. Appreciate your time, Dr. Tinker, for your talking about this subject.
Sure. Anytime, Sheldon. Thanks for the talk.
You bet. Thank you.
The death toll